Mind your space.
I would say good morning and welcome. We're glad to see such a great turnout this morning. On behalf of the Board of Trustees and our entire healthcare team, we are thrilled to have you here for what truly is a transformational day for Northwest Kansas. Today we take a major step forward in bringing world-class medical expertise directly to our region. We are proud to officially announce our collaboration with the University of Kansas Cancer Center, connecting our local patients to NCI designated leading edge oncology care, innovative clinical research, and specialized resources. We are honored to be joined today by several distinguished leaders and partners who share our commitment to expanding care. We have U.S. Senator Jerry Moran. Jerry's been with us several times. He's a tireless advocate for rural health access across Kansas. We have Jack Beal, Senior Vice President for the Cancer Services for the University of Kansas Health System. Dr. Gary Dolittle is the medical oncologist and telemedicine pioneer with the University of Kansas Cancer Center. Representatives from the Masonic Cancer Alliance, our own leadership team, including Citizens Health, David McCorkle. Every family in our community deserves access to top-tier cancer care without the strain of traveling hundreds of miles. This partnership reinforces our promise to invest in local health, elevate patient outcomes, and strengthen rural care. To open our speaking program, it's my privilege to introduce a champion for Kansas who understands firsthand critical role rural hospitals play in keeping our communities healthy. Please help welcome Senator Jerry Moran.
Good morning. It's great to be back in Northwest Kansas. It's great to be back in our part of Kansas, the place I call home. And it's great to be back in Citizens Medical Center for like the 16th time over the last 5-6 years. Starting with Greg and moving forward into the new administration, we've tried to engage with this community in every way possible to see success in healthcare and to see that benefit the citizens of this part of Kansas. I appreciate very much this community's support for Citizens Medical Center, for healthcare, and now we're taking it another step forward. In many ways, this is what you dream about, that we can create opportunities for the latest technology and science and medicine advances to be available to all Kansans, regardless of where they live. And I'm very appreciative of the University of Kansas Health System, the Cancer Center, the University of Kansas, the School of Medicine, in its efforts to make sure that they help us fulfill that dream of every Kansan having access to quality health care. We've worked in this arena. Seth Carter is here, the president of the community college, and I would highlight the work that Colby Community College does in vocational and technical training, educational arena for our healthcare professionals. No matter where I've visited every hospital in Kansas, 130 of them now. There's lots of common denominators. They'll talk to me about 340B, and they'll talk to me about the opportunity that they have to try to expand care. But the common denominator, they'll complain about CMS. That list is long, what they all say. But the common denominator of every hospital, every healthcare provider in Kansas is we don't have the people to work where we need them to accomplish what we need to accomplish. And so what happens at Colby Community College and Fort Hays State University and the University of Kansas and all of our educational institutions create an opportunity for us to have a higher quality of life and better health care. My entree to this kind of oncology services started a long time ago, and I think I was still in the House of Representatives with KU, and we created an opportunity to connect KU with Goodland and telemedicine. And I was amazed at the compliments that came from my constituents who had something. I assumed that telemedicine would be something that would be a last choice, and in many instances it became a first choice. People were so pleased to have the capability to get the care they needed. And I guess it's easier to talk to a physician online than it is to talk to them in person. I find that to be the case sometimes myself. So I'm honored to be here. Congratulations to Citizens Medical Center, to this community, to Northwest Kansas. This morning I was in Oberlin and Atwood before coming here. In Atwood we toured the construction site of the new high school, another suggestion that things are improving and we got a bright future. But I would highlight, and I think the folks from Rollins County Health Center are here as well, we have a $608,000 earmark for their hospital to expand their oncology services. And what I hope that means, and as a kid who grew up in a county that has two towns about the same size and neither one of us can get along, the home of Tammy Peterman, we're the bigger city, she's the county seat. So it's difficult sometimes to get us to cooperate, but really the reality is if good things are going to happen, it's going to mean that Goodland and Colby are cooperating. It's going to mean that we're reaching out to Atwood and that we're all pulling together to take care of the people who live here. And the ultimate goal of that is not only to take care of ourselves, but to make sure that this investment, this community made in this hospital and its medical community and the capabilities of cancer diagnosis and treatment that occur here, it's for something more than just ourselves. It means that our communities have a future and that other people will find us a good place to live. And our kids may decide this is a pretty good place for them to raise their families. That's the goal, and you're fulfilling it here today. Thank you to the University of Kansas and the Citizens Medical Center and this community for making an opportunity so much more available than a trip to Denver or a trip to Kansas City. Thank you very much.
All right, well, thank you, Bob, and thank you, Senator Moran. Just really appreciate your leadership and unwavering support of rural healthcare across Kansas, both here locally in Colby and across the region in so many different ways. Your support is unbelievably a blessing to our community, so thank you for that. I just want to talk to you a little bit about what this partnership means and what we've been trying to create for quite a while now. A couple of years ago, Dr. Dolittle and I had the opportunity to sit and talk for a while, and he got to see firsthand, how passionate I am about oncology care, about cancer care, and that stems from an experience that I myself had as a father of a son who had cancer, and so, I had to drive significant distances to receive care for him during that time, and such a blessing that I had here in the city of Colby and in this community of so many people that helped out and cared for me and my family during that very difficult time. But as we were talking about that, we were describing the challenges that we face in rural healthcare in rural Kansas, about having to travel hundreds of miles to receive things like that, or having to travel hundreds of miles to get the resources that are available, maybe in a Kansas City or with the University of Kansas Cancer Center. So out of that conversation stemmed the idea of how can we collaborate better together? How can we do this better? How can we care for our patients better? And bringing the academic excellence that the University of Kansas Cancer Center brings, how can we blend that into our organization and care for people in this region in a way that's transforming the lives of those people? And so we're just so blessed to have the opportunity to be up here today. It's a milestone for our organization, something that, I think, will have significant lasting impacts for the future of care that can be delivered and the way it's delivered. And having that expertise and access, healthcare access to those oncologists is an unbelievable blessing that our patients will receive in the future. So thank you for being here. Appreciate everybody who's here to support this organization. We've got a lot of great things, but at the end of the day, it's our people that we're most blessed by. The people who come to us in need of care and the people who choose to be here and provide that care for those people. So thank you so much and appreciate y'all being here.
Thank you, David. Really, we're grateful for the opportunity to collaborate with you and your team on such an important initiative. Teamwork has been at the heart of this effort,
the compatibility of our teams, and our shared focus on putting the patient first in every decision and in every discussion is how we got here today. I want to be clear, this is the first time the University of Kansas Cancer Center has undertaken a collaboration such as this, where our team of highly specialized oncologists and oncology nurses, pharmacists, and other clinicians will be able to co-manage the care of cancer patients locally in close coordination with a hospital in rural Kansas. When you do something for the first time, there are no blueprints to follow. We came together to create an approach that reflects the expertise and experience of the teams at Citizens Health, coupled with ours. Our respective experiences and perspectives will make us stronger together, resulting in better outcomes and experiences for patients in the community. We believe Citizens Health was the perfect partner for this. Not only are our teams aligned and passionate about offering specialized cancer care close to home, Citizens Health was committed to providing the resources and infrastructure necessary to do it well and to do it right. We also know that what we learn together can help us replicate this model in other rural areas across the state, with the intention of allowing patients across Kansas the opportunity to navigate their cancer journey closer to home. As a health system and cancer center, we are committed to supporting rural healthcare across Kansas. This new collaboration is one of several ways healthcare providers across the state are coming together to collaboratively transform healthcare across our state. The Rural Health Transformation Program is an important part of that overall effort. Citizens Health is not only our partner here, but is also a member of the Anchor Hospital Advancement Program, an effort that's part of the Rural Health Transformation Program to establish key locations across the state to focus on improving technology, expansion of services, access to specialty care, and enhanced patient care. What we believe this shows is how collaboration across multiple areas with committed partners can actually move the needle on rural health challenges and, most importantly, create better healthcare outcomes for patients. Keeping care close to home and sustaining communities where care is provided is our goal, and today's announcement is an important step forward. Of course, we couldn't have taken this step without the support and effort of all of our teams, but I would like to specifically mention, amongst others, Senator Moran. Your commitment to cancer care in Kansas and access to it is unmatched and very much appreciated. Bob Page, CEO of the University of Kansas Health System, and Tammy Peterman, President of the University of Kansas Health System, who are here today and who are deeply committed to ensuring all Kansans benefit from the state's only academic medical center. Gloria Solis, who has worked side by side with counterparts in Colby to make this vision a reality. Of course, Dr. Gary Dolittle, who had the early vision, was a tireless champion for how this could work and the impact it could have. With that, I'd like to actually turn it over to Dr. Gary Dolittle to say a few words.
I'm sure you all noticed that Jack just hopped up and hopped down, but given my phase in life, I could be considered a falls risk, so I very carefully watched my step. There's just so many people to thank when it comes to this project in general. Senator Moran, you've just been a tireless advocate for cancer research, for the KU Cancer Center, for healthcare in Kansas, rural Kansas. It can't be said enough, and it's very much appreciated. I remember the Goodwin Grant very well. It propelled telemedicine in a different place, having that kind of support. Really want to thank the leadership of Citizens. There are many people that were involved in this project on the citizen side, and I think it's just a lot of good people coming together trying to make things happen for the right reasons. When I look back at Kansas in the mid-90s, we were really pioneers in the use of telemedicine and providing care at a distance. And when I think about what it was like then, and when I think about what it's like now, it's stunning, the changes that have happened. So much of the cancer care that we deliver now is much more complicated than it was in the mid-90s. I tell the fellows now, when I studied for boards, I really want to know about 20 to 30 drugs really well. And now in 2026, we get 2 or 3 new drugs a week that are approved by the FDA. So the complexity has been so much greater, and it has evolved that way. Our molecular testing, our immunotherapies, our targeted agents that we have, not to mention the other technology, electronic medical record, which was my worst enemy 10 years ago, has become my best friend in the practice of medicine now. Without the advances in the technology, I don't think we'd be able to do what we're doing today. But even with the technology, I've always felt this, it is a tool. And it's really about bringing people together. And this is just a tool that enables us to provide cancer care at a distance and make sure patients are able to stay close to home. And that's really what this partnership is all about. It's about allowing patients to receive high-quality, sophisticated cancer care close to home. We want to reduce the burden of travel. If you don't feel well, getting in a car and driving 3 hours one way to get your care is really, it just compounds the challenge. We'd like to think it makes life easier for family and caregivers as well. Cancer affects families. It doesn't, in addition to our primary concern, which is the patient, it spreads to families as well. And what we can do to try to support that close to home is so critical. I'm particularly excited about working with the team here at Citizens. Many of the people that are here I worked with 20-some years ago. I used to staff an outreach clinic in Hayes, Kansas, and knew a lot of the Colby team really well. It's really kind of exciting to see them still at it and still making things better for cancer patients in Kansas. A tremendous amount of expertise exists here, dedication and commitment to patients. It's like no other. As has been mentioned, starting a practice like this, it takes a tremendous amount of work. I had started several practices in the past, but that was pre-electronic medical record, and oh my gosh, pre a lot of things that we're dealing with today in the practice of medicine. So I really want to thank everyone that's spent countless hours, okay, days. Well, let's admit it, it's been months pulling all this together, right? I mean, it's just been a huge effort on the part of both organizations. I think this is really more than a new clinic. I think this is a new model to deliver cancer care. One that combines the expertise of KU Cancer Center with the knowledge and sincere commitment of Citizens Medical Center and the team out here. I'm so excited about what we're beginning together, even more excited about what this is going to mean for our cancer patients and their families. This is what I had hoped for 30 years ago in telemedicine, and it's actually become a reality. And everybody in the room has been part of that, and I thank you all very much.
Dr. Dolittle, thank you so much. You know, your vision and determination to make this happen is the reason why we're all here today. This is a milestone for our organization and for the care that we're able to deliver, so I want to especially thank you for that, and very much a blessing to our organization. So now I think we've got time to open it up for a few questions, and so if there are any questions for anybody up here or anybody that spoke today. Yes, Janine.
So if a patient who has cancer wants to be seen, what are the steps to initiate that?
Yeah, so they can reach out to our oncology team here. We have.
Repeat the question, sir.
Oh, yeah. Janine had asked if a patient would like to receive care through this program, how do they get in touch with somebody? They can reach out to our local oncology team here. We've got a team of navigators that will connect with KU, and those teams then begin the pre-work and the initial work of how to establish a patient inside the system. So.
Can you tell me a little bit about how we're utilizing our telehealth services and what's on this side that we're providing?
Yeah, so the way the program is designed, how does the program actually work? I think we're looking at the cameras there. So how does the program actually work? Well, when patients are established, they go through that patient navigation, they identify what type of specialty they need to be seen, what oncologist from the university is going to be assigned to that patient. The telehealth aspect of that is the patients see all of the oncologists via telehealth or virtually. All the hands-on care provided is going to be done here within this organization. We've spent a vast amount of time working on those protocols and those scenarios for different patients and how we make this efficient for patients and make it convenient for patients. And you know, a huge shout out to all the teams that have spent tireless hours working together to really make this a seamless process for the patients, and that's what's important. When you're dealing with, you know, a cancer diagnosis, the last thing you want to think about is, am I going to be cared for well? And so the teams have done a really, really good job of making this a seamless and convenient process for patients to go through. And I'm just super proud of the work that's been put together. Oriana and her team, you know, everybody that's worked together to build this program, Gloria, so many people to thank from the University of Kansas to help us build this. There's a lot of aspects that go into cancer care, and so we've been extremely detailed in going through all of those to get to the point that we're at today, and so very proud of that.
David, I'm usually the recipient of questions, but I'd like to be the asker of a question. What is it that the University of Kansas, I want to give folks a chance to understand what the University of Kansas is doing in cancer research and treatment. And what is it the University of Kansas offers somebody from Colby, Kansas in this partnership? What do they do well? What can they treat? Tell us the benefits that come from the partnership.
You have to repeat that question.
The question is, what will patients experience from the University of Kansas? What does that actually bring to the practice itself? And there's so many different aspects about the care of a cancer patient, but right off the bat, it is identifying the healthcare team. And as a cancer survivor myself, I think the first 2 days, the first 48 hours are the worst, because you don't know where to turn, you don't know whether you're going to get good care. Even if you have a great family medicine doc or whatever, the first couple of days are really rough. So a patient from Colby or a patient from surrounding Colby area, they call the cancer center here and they get assigned to a navigator, and right off the bat, that navigator has an idea of who that patient needs to see for care. What KU brings to the table is most of us have subspecialized in different areas of cancer. My particular interest was skin cancer, and in particular malignant melanoma. So we will be connecting cancer patients from this region to docs that specialize in breast cancer or docs that specialize in lung cancer. So we bring that, which is really important, and developing that is essential, but it doesn't end there. It has to end with care on the ground. So part of what they also get is a team of people that are working together, right? The nurses that are caring for these patients out here are going to know the docs on the other end, much as they know within their teams right now. It's using the technology to recreate that type of practice. I'm not sure I completely answered it, and if I didn't, then maybe that makes me a politician. I've only voted for you.
One more thing. So, tell us about the benefits of the University of Kansas. It's a cancer comprehensive center. Why does that mean something to us, and we want to see you and your docs?
Yeah, that's a great question. When you become a national cancer center, nationally designated cancer center, and we're comprehensive, it's really basically kind of a sign of approval that you have excellence in research, you have excellence in patient care, and also there's a strong commitment to serving the region that you're in. So for the KU Cancer Center, our catchment area is the state of Kansas and 18 counties in western Missouri. all the advantages of an academic center, a new research, new clinical trials, research that goes on between scientists and clinicians that you bring to the clinic. One of the stories I always tell is the story of Taxol. Now this is, get me started, I'm Irish, so you may not be able to shut me up.
And a politician.
Hey. So I couldn't do it. You know, Taxol was actually formulated at KU Lawrence. And for those of you that are not cancer related or don't understand, that's one of the biggest drugs that we use in the cancer arena, right? Or it has been historically over the last 30 years. That drug was developed on the Lawrence campus, but wound up in clinical trials through the NCI. And our patients in Kansas didn't see that drug until 5 years after it had been formulated. What we're trying to do is push all that process upstream. You know, the science and the energy that goes on at the medical center and the clinical trials that are developed at the medical center and that we have access to, we want to make sure that any patient in the state has access to that expertise and those treatment options.
Dr. Dolittle, we have a question online that maybe we can address, and then also one more comment. So once they're set up with a provider, will they continue to see that same provider over and over? And then I wonder if you talk a little bit about our relationship with MCA and other services that's not just we're going to give you medicine and get your radiation, et cetera, that we have survivorship and smoking cessation and all the things that you know about.
Okay, great. So the first question really has to do with that continuity of care, and in that when the patient meets the cancer doctor from Kansas City, that's the patient's doctor for that care. And then the team here that doctor is part of the team here, such that once the treatment plan is developed, the patient is getting care here at Colby, the follow-up visits, the coordination of whatever that therapy is, continues at Colby and continues with follow-up visits with the physician on the Kansas City campus. Again, what we're trying to do is mimic what we do in clinic every day. The only difference is the physician is at a distance. Right? With the rest, we want to work it just like we do. This is going to be excellent cancer care. This is not B care or C care. There's been tremendous effort in building this. And Gloria, I can't believe you haven't blocked my cell phone and blocked my email through this whole process for everything that you've done. Oriana, Jenny, I'm afraid to start listing things because there's so many people. But this is going to be excellent oncology care. Right? We don't want to practice medicine. The other thing that Jenny was asking about was the Masonic Cancer Alliance, and that is the outreach arm of the KU Cancer Center. And there are many support services that a cancer center needs, or that a cancer patient needs to handle the situation that they're in. Many of the services that are considered supportive can be accessed through MCA activities. MCA conducts screenings. MCA has been involved in a lot of education efforts that go on with nurses and all providers across the board. We have a clinical trials program within the Masonic Cancer Alliance that ultimately from the Kansas City area, we would like to see open up for Colby in this part of the state. We have social worker networks. We've got a psychologist that works with cancer patients, and I can tell you, if I had my druthers, anytime I saw a new cancer patient, I would like to team them up with a psychologist, because there's nothing like it. When somebody walks in the room and tells you that you have cancer, there's nothing like it. And so providing that kind of supportive care is part of the mission of the Masonic Cancer Alliance. I hope I'm not doing justice to it. But someone's going to mention this, David probably, but the bus, what I used to call a medical mobile unit, is how we'll let you go with that. But that also comes through the KU Cancer Center as well. Oh, tobacco cessation. That can all be done electronically too. Any other questions about the practice that I can help with? Can you
talk a little bit about Amber's role?
Oh, this is huge. The question is, can you talk about Amber's role? Amber is an advanced practice practitioner that will be one of the anchors here in Colby. Again, it's one thing for me as a melanoma oncologist to write orders for immunotherapy. It's another thing to make sure that the patient on the Colby end is getting everything they need for that. Amber, with her advanced practice expertise, will be present in the visits. So if I was seeing a patient out here, she would be present. She gets to hear what we're talking about. She can be the person that provides support. I think one of the things I worried most about telehealth from starting was this issue of I've got a really highly sensitive, kind of highly charged patient on the distant end, and having Amber and the other oncology nurses at this end that can provide that kind of supportive care is essential. Right? If I tell somebody their scans show that the disease is back, it's really nice to know that Amber's sitting right next to him, or one of the nurses is sitting right next to him and can provide that kind of support. And the other piece that's just critical is, you know, she's a practitioner. She can see these patients on her own as well out here. And if we do this the way it's envisioned, and we will, she will have a great working relationship with the oncologists that we have on the medical center campus. Anything else before we go back to David? Okay, great, thank you.
All right, thank you for all the questions. We do have the Hope on Wheels. It's the oncology bus that was just mentioned. It is out in the parking lot, and they're going to do tours of that. So we would invite and welcome everybody to take a tour of that while it's here in Colby. A tremendous thing to have in the state of Kansas. We would also invite anybody who is interested to come up and tour our Oncology and Infusion Center, which is right up the stairs directly up above us. So for anybody that would like to do that, please stick around, feel free to mingle. There's some snacks and drinks and stuff like that over here. And we'll be just kind of talking and giving tours and doing anything that you guys would like to see. So really, again, appreciate everybody being here. Thank you so much for being part of this milestone and this announcement that we have. And thank you for all the support that you've provided us throughout the years. Thank you so much.